it's pretty cool still after, shoot, I guess it's 13 years now.
13 years.
We've been doing this together. And just the countless amounts of people that have come through here, still to this day, gets me excited to hear their story and just to listen to, how their spine and their health affects them, their finances, their family, the quality of life. And, we use the term around here a lot, saving lives, because it really, people come in a lot of times and say, you saved my life. So today what we want to do is just kind of go through what is our philosophy of how a problem starts in the spine and the joint. It's kind of all the same. So I'd like to explain that, and I want you to share with everyone, like, our goal here as doctors in the dictionary means teachers. We love to teach people. We like for them to understand, how did you get in this situation? How am I going to get out of this situation? That's 90% of the battle. What's wrong with me? No one sit down with me and help me understand. So today we want to spend a little bit of time on that. And so the principle is the same in any joint. All joints, so we use the spine here. Here's a bone and here's a bone. All joints have to fit together. But when they fit together, they have to stay together. So here on this model, we put some rubber bands to illustrate how joints are held together, whether that's in your spine or whether that's in your knee. It's the same thing. You have a bone to bone, you have ligaments that hold us together. So on this illustration, you'll see a rubber band. And really the principle of a rubber band is it just rebounds. So its job is to hold us together, all right? So you can see our bodies are made to be stable, so the joint's stable, but it also has to have some flexibility, but not too much. That's what the rubber band does, okay, or the ligament. And what happens from about 0 to 20-ish in a human being as we're growing, in our long bones, especially the legs and whatnot, we have bone marrow, and our bone marrow makes stem cells. So these stem cells leave the bone marrow and they go through the blood and they go to everywhere in our body, including the ligaments, the disc, the joints, heart, liver, lungs, everywhere. And these cells are a blank and they have your DNA in there and they turn into that tissue when they get there. They convert into that specialized tissue. But for whatever reason, we really don't know still. At the end of the maturing process in a human, maybe 18, 20, the blood vessels will then die off for the most part to the connective tissue. So this tissue really doesn't have any blood supply like it used to. Your disc, your hip joint, the cartilage in your knee, your meniscus, all these structures, they just really don't have blood supply. So in the human body, they'd be very white in color because they have no blood supply. But we keep using these tissues. We keep pulling and stressing them and they get worn down. And so the fact that they have no blood supply, they have a very poor ability to heal and repair. So a good example, a lot of patients say, how do I know, what you're going to use is going to fix me? And we say, well, simple. If you cut your skin shaving, just say you shave your face and cut it, it always heals back. Why? Because that tissue has a lot of blood supply and it'll heal up every single time. Why don't these heal if they're in the same body? Because they have no blood supply or a poor lack of it. So this helps us to understand why spinal columns begin to break down. The tissue kind of falls apart. You see all these degenerative processes starting, and then the patient comes and sees us. They've been taking medications, doing therapies, they've been doing all this stuff, and the condition just continues to worsen. So, Sean, I'd like for you to kind of explain, in a degenerative process, ligaments break down, they have the inability to heal. People are going to pain management, they're taking drugs, medications, end up in surgery, they're living crappy lives, continue to break down. So what does a regenerative protocol entail that could help someone to actually repair tissue that just is not?
Sure. Well, I'm going to start at the stage where a spinal patient most commonly comes in to see us. They have symptoms with back pain that may include pain extension down the leg, what we call radicular pain, and that's often due to a herniated disc. And a disc is just another ligament holding bones together that has become degenerative. And when it becomes degenerative, it doesn't function the same way. So a herniated disc will push on a nerve root and cause those symptoms of pain from your back running down one leg or the other, may cause numbness, tingling, or weakness. And we've built protocols over the past 13 years that in the first step will actually reduce the compression on that nerve, basically decompressing that nerve. Now, once that's accomplished, our goal from a regenerative standpoint is to actually transfer those cells that are in your blood that have the ability to heal tissue, the platelets, the stem cells, and get them into tissue that has inadequate blood supply so that that healing can take place. So in the spine, for instance, we'll draw blood, we'll spin it down to isolate the platelets, and we'll inject those platelets around the facet joints, which are joints in your back, around the ligaments. There's ligaments at all levels of the spine. So there's ligaments at the top of those spinous processes that you can feel on your back. There's ligaments in between them. There's ligaments connecting those facet joints. And then there's ligaments, as I mentioned, the disc is a ligament. We'll actually inject platelets into the disc to stabilize the spine both posteriorly and anteriorly, basically a 360-degree stabilization, which often results in significant relief in terms of the patient's symptoms, but also from a functional standpoint, they return to more of a normal level of functioning.
So what we want you to understand today is that, our bodies were made to function. They're made to be stable. So we use the word stability a lot here. Ligaments stabilize the joint, but also allow flexibility. When these ligaments become damaged, the joint is hypermobile. It doesn't move enough. But the patient will present a lot of times the muscles will come in and overcompensate and really hold that from moving. Now the joint doesn't move at all. It doesn't get water in the disc. The disc will crack. And as Sean said, it'll herniate. So our method is to decompress this, get the disc repositioned, and then apply some kind of regenerative techniques to try to heal and repair this tissue to bring it back to that stable function, and the person gets their life back. But it never fails how fun it is to see a patient come in so sick and just first of all, they're frustrated because they just don't know what's wrong. They love it when we teach them and educate. I love to see that light bulb go off like, man, there's hope here. And then to watch them get better, that quality of life pop back, it's exciting. And we just always say around here, we're saving lives.
Absolutely.
So I hope you learned something today, and I hope this would help you to understand why maybe you're still suffering, why you're still having to take medicine, why the condition remains. It's just a lack of healing, and the body can heal. And that's what we do here. We put regenerative protocols together to get you better.